Welcome back. I am Sister Tandy. Today, I am addressing one of the most common questions we hear. Why did my colleague get a different result than I did? We do the same job. We are the same age. How is it possible that they were declared fit and I was not? It is a fair question, and it deserves an honest answer. Whether you are a worker trying to understand your outcome or an employer explaining results to your team, this video will help. Always consult with your healthcare provider. The first thing to understand is that even if two people have the same job title, their bodies are different. One person might have naturally higher blood pressure due to genetics. Another might have stronger lungs because they never smoked. A third might have slightly reduced hearing from a previous job. Your body carries its own history, your genetics, your lifestyle, your previous exposures, your age, and any pre-existing conditions. All of these affect your medical results independently of your current job. Your medical does not just assess your current fitness. It compares your results to your baseline from when you started. If your colleague had a healthy baseline and their periodic results are stable, they are tracking well. If your baseline showed early signs of a condition that has now progressed, your periodic results tell a different story. The same job, the same exposure, but two different health trajectories. That is not unfair. That is biology. Another factor is the man's job specification. Even within the same job title, two workers might have slightly different exposure profiles. One might work primarily at height, while the other works on the ground floor. One might be in a noisier section of the factory. These differences change which tests are done and what the pass criteria are. Your medical is matched to your specific exposure, not just your job title. Lifestyle factors also play a role. Smoking, diet, exercise, alcohol consumption, sleep quality, and stress management all affect your health numbers independently of workplace exposure. Two workers doing the same job but living very different lives outside of work will have different health profiles. This is not a judgment, it is simply reality. And it is one of the reasons why the lifestyle advice in these videos matters so much. I understand that it can feel unfair when a colleague gets a different result. It can feel like the system is arbitrary, but I promise you it is not. Every result is based on your individual health data, your specific exposure profile, and clinical standards that apply equally to everyone. If you disagree with your result, you have the right to request a review or a second opinion. SADAG can support you if the emotional impact is significant. 0800 567 567 www.sadag.organization. Always consult with your healthcare provider. For employers, when workers compare results and become upset, explain that medicals are personalized to each individual. Encourage them to focus on their own health journey rather than comparing themselves to others. And ensure your workplace does not foster a culture of competition over medical outcomes. Health is personal. Treat it that way. Always consult with your safety officer. Your employer chose a medical system that assesses each person as an individual, not as a number in a batch. That personalization is what makes occupational health meaningful. Your result is yours. It reflects your unique health profile, and it is designed specifically to protect you. Always consult with your healthcare provider. Now you understand why medical outcomes differ between employees, what it means, why it matters, and what to do about it. In our next video, we explore why honesty during your medical matters. Always consult with your healthcare provider. Keep watching. Your health is as unique as your fingerprint. Comparing your results to a colleague's is like comparing two different maps for two different journeys. Focus on your numbers, your trends, and your next steps. That is where your power lies. Always consult with your healthcare provider. Your best is good enough for today. See you next time.
CareNet Consultants, your partner in workplace health.